This is exactly the kind of stuff that I think you should be focusing on in your essay when you're trying to get into nursing school, PA school, medical school. Hi everyone, I'm Boris. I'm a second year physician assistant student, and today I want to tell you about the best PA, the best physician assistant I've ever worked with. Good morning, it's Saturday, which means I'm drinking my coffee with cream today. So one of my resolutions for 2021 is to get down to about 10% body fat for the first time in my life. It's a goal I've had forever, and I just thought 2021 is finally the time to just buckle down and do what needs to be done and do it. So I'm really focusing on intermittent fasting, a pretty strict diet, and weight training. So mostly my mornings I drink black coffee, but on weekends I allow just a little bit of half and half, which is freaking delicious. So if you're one of my amazing, loyal followers, or you're new to the channel, could you do me a favor right now and post a comment with one of the resolutions you have for 2021? I'd really love to hear what you're working on, what everyone's trying to work on this year, to try to make it the best year ever, definitely better than 2020 was. Okay, so anyway, the best PA I've ever worked with so far in my very short medical career is actually my current preceptor. So I'm currently on my third clinical rotation, which is crazy to think about that I only have about 6 months left of PA school. That's just absolutely nuts. I can't even fathom that. But anyway, so I'm on my third rotation, which is emergency medicine, and the rotation is actually at the same hospital, the same emergency room that I was a scribe at and that I got a lot of my PCE hours 2, maybe 3 years ago at this point, which is also crazy to think about. But anyway, so I've known this PA for a few years, and back when I was a scribe, I remember he was always really friendly, he's always been a really hard worker, he was always one of the most productive, if not the most productive PAs in the department, and he just saw a lot of patients and people seemed to like him. But that's all I really knew. That's all I knew about him. I never scribed for him because scribes only worked with the doctors. The PAs didn't get scribes back in the day when I was scribing. So I never really shadowed him either. Honestly, I didn't have time for that, and I didn't really need any more shadowing hours. I had enough of that. So basically, I just never really worked with him. All I knew was that he was a really hard worker and a really nice guy. But now that I'm working with him as a rotation student, spending 10, 12 hours at a time really getting to know him and seeing how he treats his patients, how he treats the staff. And holy crap, when I'm a PA, I want to be just like this guy. Even now as a second year PA student, kind of pretending to be a real PA, I'm trying to be more like him every day. And just a really quick nugget of wisdom that I've learned from my own life is when you're trying to do something, you can read all the books you want on the topic, you could watch videos like this one, and it really helps when you're trying to get good at something or you're trying to accomplish something. But nothing makes you learn and improve faster than having a good mentor. Just being around someone that you really respect, who's doing what you're doing the way that you want to do it, just being around them for a few hours at a time, noticing how they do things, how they do little things, how they talk to people, how they treat people, little nuances and details in how they spend their day just makes all the difference in the world. Because things that you might not think are important, or things that nobody who writes a book or makes a video might think are important, those things can make all the difference in the world. And I'm going to give you some examples. So, specifically, what am I talking about? When I edit your guys' essays, I'm always saying, be specific. Tell me something specific, paint me a picture. So let me be specific and paint you a picture. When this guy, my preceptor, let's call him Joe. That's not his real name, but, people need a name, even in the stories. So, let's call him Joe. When Joe comes into a patient's room and he's talking to a patient, he's really nice, he's really friendly, which, a lot of doctors, a lot of PAs are really nice and friendly, that's good. But one thing that Joe does that I haven't seen anybody else do when they're talking to a patient is he physically comforts the patient. He's always got his hand on their shoulder, on their arm, and he's just kind of like gently comforting them as they're talking. I don't think he even notices that he does this, but it's something that I noticed, and I noticed that nobody else does it. And at first I thought it was kind of weird, what are you doing? Why are you touching this patient? It's very fatherly. But now that I'm noticing it more and more, and I notice how the patients are responding to it, you can just see it in the patient's eyes. They feel comfortable with Joe. I'm sure that if a patient started to look uncomfortable, Joe would stop touching them, he would regroup, but I haven't seen one single time where that's been the case. And I've been in the room with Joe talking to patients probably dozens, if not over 100 times by now, in the weeks that I've been on rotation with him. And it doesn't matter if the patient is 22 or 102, if they're a man or a woman, Joe treats every single patient like they're his kids, like their family. Like he's gonna take care of them no matter what. And that's so powerful. No matter what the patient's going through, whether they have a little 2-centimeter cut on their leg that we just have to stitch up and it's no big deal, or if they're having a stroke or something big is happening to them, no matter what's going on, that level of care and compassion makes all the difference in the world. And it helps to put the patient at ease. And it's definitely something that I'm starting to implement in my own practice, even as a student. I'm not really comfortable doing exactly what Joe does, but I do try to be more comforting in my voice, in my eye contact. I try to slow down and take the time to let the patient know that they're going to be okay, that I'm going to take care of them. And I may place my hand, on their shoulder, on their arm, just for a few seconds while we talk. I might do that. And I've noticed the positive attitudes from the patients, and it's helped me to get them to open up about what's going on and to feel better about being at the ER. Nobody wants to be at the ER. It makes them feel better about being there and about the testing and the treatment plan that I'm trying to describe to them, what I want to do with them to try to get them better. It just really puts them at ease. And I've noticed that it makes them more comfortable, and that's really, really important when you're doing patient care. Okay, so one more thing that Joe does, and just a reminder, Joe's not his real name. I just think people need names even when I'm telling a story about them, and I don't want to give you his real name, But anyway, one more thing that Joe does. When he walks around the hospital, this dude knows everyone. He knows everyone's name. He knows at least a few things going on in everyone's life. And he tells them they're doing a great job. Holy crap. Holy crap, is that a big deal? Most people are so totally consumed with their own life, their own job, whatever they got going on, whatever they're worried about. But this guy, Joe, he takes the time to pay attention to all of his coworkers, not just the PAs, not just the doctors, but everyone. Nurses, housekeeping staff, cleaning crew, kitchen crew, respiratory therapists, paramedics, you name it. He knows everyone. Literally knows everybody's name and something going on in everyone's life. He knows them and he shows that he cares about them. And this is something that's actually, honestly for me, this is something that's been hard for me to do in my own life, because I kind of use the excuse. I said that I'm simply just not someone who remembers names. If I see someone I saw maybe a few weeks ago, a few months ago, yeah, I'll remember their face, but I just don't remember their name, and I use that excuse saying like, hey, I'm just bad with names. That's BS. Guys, if you're saying this, I'm telling you right now, it's BS, because as I've gotten to know Joe and as I've tried to emulate his behaviors, I've noticed that I'm better with names, I'm better with remembering people. You know why? Because I used to be, honest to God truth, I used to be just too focused on myself, on what I had going on. Joe barely ever focuses on himself, and not in a bad way, in a good way. He barely ever focuses on himself. He's always looking around to see how everybody around him is doing. He's always interacting. He's always paying attention to what other people are doing and what they need. Even if it's just a friendly, hey, how you doing? Hey, how's that house you're building? Or, hey, I just want everyone to know you're doing a really great job. And he's sincere about it. I love it. I'm going to emulate it. I want to be like Joe. Alright guys, so just to wrap this up, I just want to emphasize how important I think it is to find a mentor and spend time with them. And I want to emphasize how powerful human-to-human connections are when you just take a few seconds to get out of your head and just to be kind to people and just to pay attention to them. Not what you got going on, not what you're thinking or feeling or worried about, what they've got going on. Just get out of your head and pay attention for a second. Try it. You'll thank me later. And again, I want to be like Joe. And by the way, these things that I described here in this video, this is exactly the kind of stuff that I think you should be focusing on in your essay when you're trying to get into nursing school, PA school, medical school. Little details, painting a picture like I think I just did, making the admission people know that you appreciate these little things and you know how to describe them. I'm just saying it would behoove you to pepper in some of this stuff into your essay and into your interviews. I'm telling you, it's a big deal. It's a big deal, and it's really going to do good for you. I can promise you that. All right, guys. I'll see you in the next video. Thanks for watching.